Our topic is intellectual development disorder. I'm Eric Tomasi.
I'm Megan Ferrucci. So a definition of intellectual developmental disorder is deficits in intellectual functioning and adaptive behavior. You have to have both of those, and emergence has to be in early development. For the categories of the DSM, it's in the neurodevelopmental category. And for IDD prevalence, it's 1% of the general population, so 6 in 1,000 people, specifically have the severe level. And males are more likely to get IDD. Our paper was specifically focused on Down syndrome, which is when you have an extra copy of chromosome 21, and 1 in 691 babies have Down syndrome. So for the DSM-5 criteria, you have the first part, which is deficits in intellectual functioning, and you have deficits in adaptive functioning. And the third part is the onset has to be during your developmental period, and then you have to specify whether it's mild, moderate, severe, or profound. For etiology, there are multiple causes for IDD, and one of them is medical causes, such as genes that are inherited. You can have infections during pregnancy, such as an STD. The mother's behavior can actually also be a factor, and such as alcohol or drugs during pregnancy, and complications at birth, such as a lack of oxygen or a low birth weight. And then there are also factors during your childhood that can lead to IDD. And then the risk factors can be broken down between prenatal, perinatal, and postnatal. So prenatal is before the birth. Perinatal is 5 months gestation to 1 month after the birth, and postnatal is 1 month after the birth and beyond. So an example of prenatal would be genetic disorders such as or fetal alcohol syndrome. And then perinatal risk factors over here are intrauterine disorder and neonatal. And then postnatal, an example of those is head injuries during your childhood or exposure to toxins.
All right, for the presentation and symptoms, you can see the normal curve here of IQ scores. The average IQ score is 100, and someone who has an IQ of 70 or less is considered to be intellectually disabled. And some sources will say 75, but the standard is usually 70. Parents will also notice that their child has difficulty with walking, talking, eating, and abstract thinking. For instance, they can't really plan or think ahead in the future. They might have difficulties with making a snack or even going to get it themselves. For developmental course, longevity is that they usually have shorter lives than a normal person. Microcephaly is that their head is usually smaller and certain parts of their brain are not as developed as they should be. Normal sequence of development at different ages. People with IDD will develop. It will just take them longer to do so, and they will hit milestones at later ages. Education is very important, and they will usually be given IEPs or individualized education plans, and their outcome will depend on how quality their education and therapy treatment is. As people age, people with Down syndrome will become introverted and withdrawn. One of the reasons for that is because they lack social skills, and an important part of that is that they will make decisions that are not very good since they will lack judgment in dangerous situations. Finally, treatment. Behavior therapy is very critical. They will often use ABA therapy or applied behavior analysis. And an article that we read talked about how children who received additional group-based therapy treatments that had a behavioral component had better outcomes than those children who just used the one-on-one behavioral therapy itself. And this was tested over a series of 8 months. However, both groups showed progress with the behavioral therapy. Also, occupational and physical therapy is often used to help the children with their motor skills. And finally, pharmacological treatment is available, such as an antipsychotic drug called risperidone, and that will help to alleviate some of the cognitive and behavioral symptoms that will allow the child to focus on their therapies and improve their intellectual functioning.
Okay, so for our interview, we actually also did an observation. We interviewed the mother who had a child with Down syndrome, and he was 7 years old. It took place at their home. We did the interview at the dining room table, and it's important to note that this is just, a normal day. We had, the rest of the family members walking in and out of the house. We made sure to ask open-ended questions that were broken down into specific categories related to our paper. And for the observation part, it was, the naturalistic setting. We used some of his favorite toys that he wanted to play with. And he was also very athletic. Everything that he wanted to do was either like basketball, tossing a toy. And then we also sat with him while he was eating his dinner too.
All right, for the analysis, we noticed a lot of overlap between what we researched as well as what we saw in the interview. So for instance, the child we interviewed received home-based therapy services. This was for 3 hours a day and for 4 days a week. And this was, again, a behavioral component in which he learned a lot of different skills. For instance, you can see this calendar up here. And again, since people with IDD lack the ability to think ahead and plan, they made these calendars for him that had pictures that correlated with the different activities he was supposed to do. So for instance, it would outline every activity he needed to do, such as waking up, then a picture of a school bus to remind him that he needs to get on the bus, picture of school because that's where he needs to sit down for several hours to learn, picture of home when he has to go back home, eating dinner, and then finally going back to bed. And it will be a lot more detailed than this too. We'll have everything from going to the bathroom and different activities throughout his school day. Also, he displayed difficulties in eating as well. We were able to observe him eating, and they actually have to set a time limit for how long he gets to eat. He's been diagnosed with faulty eating, and it will take him several hours to eat a small piece of food if they let him. So that's why they need to time him so they can try to train him to work on that better. Also, his mother was 47 years old, and one of the big risk factors of Down syndrome in particular is advanced maternal age. Also, he showed a lack of focus and difficulty remembering things when he was playing basketball. If he was kind of left alone, he was able to make the shots, but once other people were around, he couldn't focus and he wasn't able to. Also, we thought it was interesting that he displayed really good joint attention. We know that people who have autism spectrum disorder often struggle with joint attention. However, he was able to master this really well. And finally, for conclusions and implications, more research should be done on the treatments. Read an article about how a lot of pharmacological treatments are now being targeted towards people who have IDD. And the more they can learn about the pathways and the genetic causes of it, they can actually use certain drugs to target different behaviors and different pathways that will be more helpful to them. Also, early intervention is really key, as we talked about with the IEPs. The earlier you can get started on this, the better it is, because a lot of people believe there is a window in which neuroplasticity is highest. Also, it should be noted that children can improve and they can learn with hard work and a lot of therapy, but it will just be at a slow pace compared to normative development.